Welcome to the live checkup. This is where we sit down with Dr. Asante Le Blanc and ask all the possible questions we can when it comes to our health and care. Let me just tell you this first off. Dr. Asante Le Blanc is the medical director and owner of Victoria Clinic, your home for holistic health care in Trinidad and Tobago. Victoria Clinic is located at 54 Galley Street in Woodbrook. Dr. LeBlanc is a medical doctor and certified medical herbalist. She is an integrative health care practitioner, bringing together the eastern and western branches of medicine so as to better guide patients on their path to optimum health. She's also a certified clinical densitometrist, specialist in diagnosis and treatment of osteoporosis. At Victoria Clinic, services offered include medical consultations, traditional Chinese medicine consultations, acupuncture, medical herbalism, blood tests, electrocardiograms, lung function testing, and Dexter bone density testing. You can contact Victoria Clinic at 622-2221 or 622-0683. Follow them on Facebook, Victoria Clinic, or Instagram, Victoria Clinic _Trinidad. Website www.victoria-clinic.net. This is the live checkup. I'm JD. Now, let's jump into today's conversation.
2, 1.
Hey guys, how are you? Welcome back to another episode of the live checkup. It is all about finding out all we can, in case you're looking on for the first time, what we can from Dr. Asante Le Blanc, and that's the person right next to me, about our health and what we need to do better than we currently are. And if you're like me, we are messing up just a little bit when it comes to our health. So thankfully, over the past 2.5 years, I've been sitting inside of this space with Dr. Asante Le Blanc, and it is always a joy to just be inside of another, not only episode, but a new season with the doctor. So happy new year to you and yours, but a special happy new year to you, Dr. Asante Le Blanc. How are you doing?
I am good. Happy New Year. Happy New Year, everybody. I'm good, JD. I'm good. I'm pumping. I'm ready.
I think we can still say happy new year. Never mind we're in week 3 of it, but I think we're still, you say happy new year for the entire month. It just is what it is. And you still have to practice excessively in the 2021 and not saying 2020, because sometimes we mess
Yeah.
up with that. Yeah.
Still. But yeah, it's a new year, but it seems to be a sequel of 2020. So
Oh,
fingers crossed.
and indeed, you're right. It is a brand new year. And unfortunately, and I guess fortunately for those that are picking up on it, but unfortunately, some of us are still having some issues with our health. Some may as well know about it and just not have been doing the correct things still. Yeah. So I wanted to just make sure that we certainly come back on this platform because you always find such a great way to explain it in not just basic, but just make it as easy as possible and not as jovial. Yes, jovial, but because health is serious, but you know what I mean? You make it easy for us to take in the information, jot it down, and share this with friends. Speaking about share, by the way, guys, share this with everybody you know. The live checkup, we've been 2.5 years doing this live even before COVID. So we thought about this long before. Hello.
Yes. And we have to make our own channel and we have to get going. It's a new year.
Understand? So big
We have to
things
do
are
things
coming.
right.
Yes.
Yes.
But today we're starting it off because we are in the side of the month of January. And, most recently, you and I were having a conversation, Dr. LeBlanc, about this month and what it signifies in terms of another one of the cancers that we have to deal with. And you and your team at not only Victoria Clinic, but you're also the chairperson of the Trinidad and Tobago Cancer Society. So you have to deal with it there. So I'm very excited that you're here with us today. I just want to jump in straight to that question. Cervical cancer, we've been hearing about it. Can you please break that down as to what it is, maybe the age of who it affects, etc.? And I'll just come along
Wow.
for the ride.
Oh gosh, it's a new year. I thought we had changed we flipped the script. So yes, JD, it's a pleasure being back. Cervical cancer is a cancer of the cervix. The cervix is the lower third of the womb or the uterus. So it's the neck of the uterus, basically. The cancer, this is a very prominent cancer. in women in the Caribbean and worldwide. It accounts in Trinidad right now. It accounts for at least 34% of cancer deaths in women in Trinidad and Tobago. So, but you know, the important thing to understand is that this is a cancer that, dare I say, is preventable, survivable, and curable once caught or detected at the right time. And early detection is key. And this is all done by a screening and prevention, as we just described, as I just told you. Cervical cancer, how do we prevent it? Cervical cancer is...
Sorry, don't mean to cut you, but how do we even get it? What is
right?
happening?
So that's important. So the risk factors of cervical cancer include when you have a lot of children with a short period between them.
Right.
Also, we have seen multiple sexual partners, so promiscuity, and that's two-way, but the main way for that is due to HPV infection. So HPV infection is the human papillomavirus, and there are about 2 to 4 types of the virus that are accountable or noted to be high risk factors and very much tightly linked to cervical cancer, right, appearing in a woman.
Right.
So, and then we have very early menarche, very early start of a period. We have not having children as a risk factor.
Wow.
We also then go on to other factors for that are attributable or risk factors of cancers, which include smoking, vaping, excessive alcohol intake, and a sedentary lifestyle, imbalanced diet, and poor exercise, because cancer is a lifestyle disease. You know, JD, HPV is a virus that has been around for years, and the majority of the population, in terms of the female population, clear the HPV virus from the body through our immune system normal functioning, the normal function of our immune system. Now, there's a certain small percentage of women and girls who do not clear the virus properly, and when the specific types numbers, so they have types. So there are many human papillomaviruses, and we have different types. So we have 16, 18 are the principal, and then we have 31, 33 that help with that could produce genital warts. So when they don't clear it, it can then cause a change in the cells of the cervix. So cancer, as you know, as I've told you many times, is bad behaved cells.
Right.
So it's when cells change their function and their structure than what they're supposed to be, and therefore all cells have programmed cell death or apoptosis. And when cells don't die when they're supposed to, and they keep growing and can have function, these are what cancers really are: bad behaved cells that have lost the ability to die, that have taken on a new morphology and a new functioning. So cervical cancer, so our body, what it does is, every time, so a classic thing, JD, is if you walk barefooted in the house, you will get calloused feet, right? Your skin at the bottom of your feet will get a little harder. If you wash your hands consistently and don't moisturize, the hands get dry and hard. So that is, right, so that is your skin, that's your body trying to protect you. So it decides, there's an irritant, something is happening, there's an abrasive action here, let's protect. So it grows a bigger cap, it grows a thicker layer. So think of your cervix being consistently hit with the virus, or also excessive sexual partners, different sexual partners, trauma to the cervix, so many children, without a period of healing, so the proper intergenetic period of 2 years. So these are just a few things. And so then the cells change. And so the cells change, and when they change, through the pap smear, we can detect the cells as they're changing. Because we look at
doing what they're supposed to be doing in terms of protecting.
Exactly, because we're looking at a zone between the ecto and the endo, so between the outer and the inner. We look at that layer. And when that layer begins to show changes, that's when we know something is up. So we can detect precancerous lesions before they turn to cancer if you do your screening on time.
So before we go into the screening in depth, those changes can happen within, because one of the things you mentioned most recently when we spoke, guys, Dr. Asante Le Blanc spoke most recently on radio, but you said that, one of the things you said is that as the Trinidad and Tobago Cancer Society, you encourage us to do a pap smear every year. So we will get into the pap smear, yes. But are you saying within that window of every year that cell lining can change? That's the kind of time frame we're looking at in terms of
Well,
change.
we're actually looking at a timeline of about 3 to 5 years that
Right,
we can see those changes. But because of our population, because people tend to forget, because of so many factors, we recommend annual screening,
nice.
at least when you're now starting your pap smears, because we need to get at least 3 normal annual pap smear results before we can say to you, okay, take off a year, do it every 2 years, do it every 3 years. And we also have to look at your individual lifestyle. So we have to look at if you are in a
Sexually
stable
active. Right,
relationship, sexually active, how active are you? So there are different factors. Do you smoke? Do you have family history of cervical cancer?
right.
Are you on the pill? Hormonal replacement therapies, different factors we have to look at. Do you smoke? Do you vape? Excessive alcohol? What is your lifestyle like? Different things like that we look at to determine what your frequency should be.
Right. So those are
Analyze.
the contributing factors that can possibly change during the process. So HPV, just so I understand, it's something that we already have in us, or is it something that we would get from our partner? Because
Well,
from what I
right.
understand, sorry, don't mean to cut you, because one of the things you guys said you consistently do is offer the HPV vaccine to young ones. So obviously it's something that's inside of us. Am I correct in assuming that?
No, it's contracted via sex.
But why are we offering it so young? So young. Talk about the ages.
Right, because we want to make sure that before they come into contact with the HPV, their immune system is ready to clear it.
Right. Okay.
So that is what a vaccine is about.
Preventative sort of.
Right. So it's just prevention. So it's not the all clear to have sex. It is not the all clear to go and be promiscuous. It is another layer of prevention or prophylaxis that we have now found. So what we're saying is the HPV 16 and 18 are contribute to almost 70% of cervical cancers. So if that is true, then, and we can have a vaccine, we have 2 vaccines that can contribute to immunity clearing of these
Yes.
strains,
Yes.
then we're able to give you a better chance at survivorship,
Yeah.
especially in the younger children who may be adventurous, or dare I say even, just have a different circumstance and a different outlook on life, and experiment earlier. So what we try to do is between 9 and 14 to vaccinate both girls and boys, because there are some strains of the HPV virus that also cause genital warts, right? So we want to also protect them against that. So basically what we're trying to do is promote healthier sexual practices, but also give some kind of boosting to their immune systems for those who don't clear the HPV viruses. Women,
go ahead.
go ahead.
No,
So women who are older, so like I'm young, I'm 25 plus. So I do my pap smears annually, right? Because I've passed the stage for vaccination of HPV. So I do my pap smears annually, and I'm not a lady of the night, right? So my risk factors are very low, and so I can also do HPV typing if I do my pap smear at a private clinic, that is, because we haven't brought it on at the Cancer Society as yet, but you can do that. But I do my annual pap smears, so that allows me now to track and see what's happening.
Could you just go back to what you said you don't offer? Can you tell, what is that you said? HPV what?
We don't offer the HPV typing as yet in the pap smear. So that means HPV detection while we're doing the pap smear, right? We don't offer that as yet due to the cost factor. And we are really trying to break the barrier, when it comes to access to screening services at the Cancer Society. So we offer the pap smear, which is your golden screening tool for cervical cancer.
So you're saying even though you don't do the HPV testing,
by doing your pap smears, you're still doing the perfect thing, because HPV testing does not replace the pap smear.
It just works together with it, maybe, or
I would like to say it does, but right now I would say do your pap smears. because HPV testing is a little more expensive now. It may come down, but I'm not saying that it's not something. If you can afford it, then do it. But it's not do or die. It's
And what you're
really
not saying
and
is that
truly.
so if something is to be detected, the pap smear will pick it up
The pap smear will
for
detect
sure.
the change, because even if I detect HPV in your system, all I'm saying to you is you are at risk. I am not saying to you anything else, because at the end of the day, treatment is based on what I see in your cervix, right? So it can go two-way. It's a two-way street. If I see something in the cervix, I may decide, should I check to see if HPV is the culprit? You understand? So
Yes.
at the end of the day, I have to see what's in your cervix, in that zone.
So this is the live checkup. We're chatting with Dr. Asante Le Blanc, who's not only wearing the hat of the boss at Victoria Clinic, but also she's wearing the hat of the chairwoman of the Trinidad and Tobago Cancer Society. She just disappeared for a second, but she'll be back. Never mind. That's how it goes with technology. But one of the things you spoke about, and I know there's so much thing we need to talk about in terms of the pap smear, but the HPV vaccine, how old is this? I ask this because how was it? What are we Generation X? Was this around in Generation X? Yeah, if you're falling within a particular period of the 70s and whatever. But it's not something my mother basically knew about. I'm thinking that's what I'm going at. How old is this HPV vaccine, and why was
No, it wasn't around when we were growing up at that age. It wasn't there yet, but it's been around now for over 10 years.
all
But
right?
it's not we our generation were they were now no, they weren't actually. When we were born, they weren't starting that. So it's late, and I graduated med school. We still didn't have it. So that's over a couple of years now, over 17 years. So yeah, so it's not that recent, but it's
Right.
not that old
It's not
either.
something from our
No,
time.
no, no, no.
So before we go into the pap smear, running down the process and the screening, speak to the onlookers right now who are parents of boys and girls. So just encourage those at this point the importance of taking that HPV vaccine, and how do they go about doing that?
Right. So I like to ensure that everybody's educated. And I know Google is around, so you feel free to research it. Now, you will see some negative stories. There's no doubt about it when it comes to vaccines. All vaccines have side effects, possible side effects, I should say, and it's a very small percentage. Don't be afraid, because the risk is outweighed by the benefit.
Right.
But you can get HPV vaccination free of cost in the public sector.
Oh,
You need
nice.
3 doses depending on your age, right? The younger ones, we give 2 doses to, but you can get it in the public sector and you can get it in the private sector. So it's about you making a decision and having that discussion with your young ones, both boys and girls, and making a decision, an informed decision. So
Right.
all we are saying at the Cancer Society is that we know that the HPV strains are associated with a high risk of cervical cancer, developing cervical cancer.
Right.
So make a decision. So I think that it's a very personal decision, but I also think that it's one that should be considered, because it is a risk factor. And if we can prevent a risk factor, then it's important.
Okay. All right. Do you want to talk about the treatments of cervical cancer, or should we just go in first to how the pap smears are done? What do they pick up? That's a better way to
So,
do that. Yeah.
right. So pap smears, JD, are very it's a very normal procedure. Anybody who's gone to a gynecologist, anybody, once you're sexually active, at least 3 years after you start to have sex, you need to do a pap smear, right? So a pap smear is you go into the typical gynecological position. Most women know that they just find that a little uncomfortable,
Yeah.
but it's not painful.
No.
The speculum is inserted. We visualize the cervix. We take the sample, bada boom, we're done. Less than 5 minutes, and it should not hurt. You should not have any issues. When we look at the cervix, we look at any lesions, any growths, any changes in the cells. We look at that while we're doing the pap smear, and we take the sample, we put it on a slide, and we send it off to the labs. If something comes back abnormal, then we will do what we call a colposcopy, which is that we're going in with like a magnifying glass or a big kind of what do you call these things? A telescope kind of thing.
Right. Yeah.
And we're going to magnify to see what lesions we're seeing and take biopsies, right? That's if we see something that is abnormal. But a
Right.
pap smear itself is normal. It takes less than 5 minutes and easy to do. The Cancer Society, you can call them 800 TTCS and book your appointments. And it's best to do your pap smear at least 5 days after your period has finished. That's
Yes.
the best time to do the pap smear. Ladies who are in menopause, if you're still sexually active, you have to do your pap smears. We do pap smears up even in women who are 65 and older if they're sexually active. And once we have 3 negative pap smears or normal pap smears in sequence,
Mm-hmm.
consecutive normal pap smears, and the woman is no longer sexually active, we may consider not doing a pap smear anymore after 70 years of age, or stretching it out a little more to every 3 years.
Right. Something you said just now about after you do this after 3 years of being sexually active, and that just makes me think for a second. And maybe you can speak on. I know I asked you this before, but here on this platform, speak about our statistics in Trinidad and Tobago. What you have been seeing over the years of persons coming in, new numbers, repeaters like myself who just want to make sure we do this every year, because I'm thinking where you said 3 years after being sexually active, I know a lot of women who are sexually active and have never done a pap smear. And I'm not talking
So
about some teeny boppers, I'm talking about mature women as well. So where did we fall short with sending that message 3 years after you become sexually active?
I don't think we fell short. I think it's a matter of cultural perspective.
Right.
I think it's a matter of not taking time for self-care and understanding your feminine reproductive health. And we've been promoting pap smears for years, from when the Cancer Society started with Dr. George Lackey, our founder. He used to go around in caravans to do pap smears, and we still do that. We still do mobile screening.
Oh,
We go on the mobile and do pap smears. Companies can call us. We'll go out and do the pap smears in the parking lots because we have a mobile unit that does that. So I think we are seeing more engagement. We are seeing younger population, younger girls and younger women coming in for their initial pap smears. We're seeing younger women appreciating the proactivity
mm-hmm.
about their sexual health and taking control of their sexual health. So we are seeing an improvement, but there's still a way to go, because we're still not making that break that we need to make when it comes to decreasing the numbers and the incidence and the mortality or death rate from cervical cancer in our women.
So are you saying, as you mentioned before, you do see a large number of repeaters who are staying on
Yes,
top of it, but not so
we see.
much? You would like to see more persons coming in, if I can say newbies,
Well, we've seen newbies, we've seen young
more of
first
them.
timers, we've seen, but we want more. We want those who've been coming to remember to come back. So
Yeah.
we will continue the fight and continue sending that message along with all other foundations and NGOs. But the Trinidad and Tobago Cancer Society is definitely the national voice against cancer. And we want everyone to remember that. We want everybody to talk about it. We want this to be what you talk about. You know, talk about your health, how you can prevent certain cancers, what you need to do, because we have to screen for the cancers we can screen for, know the facts. And if you have any uncertainty or doubts, then instead, speak to your healthcare practitioner, speak to
Right.
someone at the Cancer Society, get that information. So don't be afraid of the word cancer. Don't be afraid of the diagnosis. Don't be afraid of the test. Debunk the myths that the pap smear is going to cause cancer, that the pap smear is gonna hurt, it's going to spread cancer, it's the worst thing ever. Debunk all those myths and just get to it and do what you have to do as a woman.
So Jane Doe has come in. She has done her screening. She has gotten the normal results. Thank you, dear God. She goes on with her life, of course, practicing safe sex, doing all the things she needs to do when it comes to her health. Let's say Janet Doe comes in and she does the screening and you pick something up. Can you tell us what happens next? Because it is all about Cervical Cancer Awareness Month. So let's say for some unfortunate reason, you pick that up and it is that. What is the process and how does the Trinidad and Tobago Cancer Society help that person along?
So once we have an abnormal pap smear, it really depends on what the result is. So there are many results. You can get from precancerous lesions, which are called CIN lesions. You can get just ascus, which is abnormal inflammatory response. And so you have to just repeat in 6 months. So there are many responses you can get before you actually hit a cancer diagnosis.
Right.
Once, depending on what result we get, we call the person in to sit them down with a gynecologist or a doctor, and the gynecologist is a specialist involved in anything with the female reproductive system. And they come into our in-house clinic, we discuss the results with them, and we deal with it appropriately. So depending on if repeat in 6 months, repeat in 3 months, treatment in terms of if there's an infection, and then repeat the pap smear, we do go through the entire process with them. If we unfortunately find a cancer or an in situ cancer or the initial cancer lesion, we then would refer to the appropriate cancer center. So we would determine, depending on the patient's capabilities, be it private or public. But I can assure you that both sectors are well equipped and do a very good job. And JD, it's important to understand that even if you're diagnosed with cancer and you're going through the process, be it whatever is recommended, be it surgical therapy,
Yes.
chemo, radiation, whatever, depending on the staging of the cancer and everything that goes through, the process that you go through, the Cancer Society is there for you in terms of counseling and the survivor group. So we help, pardon me, we help you along the way. So you're not alone. So it's important to understand that, and when people ask, for example, someone may be sitting down asking, well, how do I know if I have cervical cancer? And it's important to understand that it's not always a disease that says, hey, I'm here. So you may get some pelvic pain. You may get discomfort in the lower abdomen. You may get lower back pain. You may get pain, bleeding and pain during sex or after sex. You may get intermenstrual spotting. I mean, you may get a discharge and you don't understand. But those may not happen. You may just begin to feel very weak and tired, fever and chills and low abdominal discomfort. And when you do your pap smear, it's there. So why am I saying this? I'm saying it because it's not a completely silent disease, but it's
Right.
a disease that you can prevent if you just do your screening. It's a disease that you can detect early and survive and live to tell the tale if you do your screening. So it's very important to understand that.
So, as always, speaking to you, Dr. Ginger, I'm kidding. Dr. Asante Le Blanc, many call her Dr. Ginger, of course, because you do the whole holistic health. I want to touch on that just a little bit, in connection to cervical cancer. Is maybe there are things that someone who has cervical cancer or cervical cancer, same difference, maybe they have to change in terms of their eating, but what about the preventative ways as well? Can you touch on both?
Jerry, that's the problem, and that's, I think people are so hung up on trying to be very finite and oh my
Yeah.
gosh, is it
Yeah.
this? Is it that? And I want to impress on you that cancer is a lifestyle disease. And it's important to understand that it's about a balanced diet and a healthy diet. And we've said this over and over again. So I want to impress upon you the use of using no preservatives, using natural foods, growing local, eating local, avoiding excessively hormone infiltrated chicken and other meats, even decreasing your consumption of meats. I mean, so there's a big debate, plant-based versus animal-based. And that's a debate that can go on forever. But I always tell you, JD, and everyone else, as balanced as possible.
Right.
Understand your body and eat as balanced as possible. And obviously don't have sugars that make no sense. So the fructose corn syrup, the high fructose corn syrup, and all these excessive white sugars,
Yeah.
sweeteners that make no sense. Train yourself to have a very natural and balanced diet, and that's the best recommendation I have for you.
And that's for both you're talking about, just those trying to be proactive. Some
Yeah, exactly.
someone who's
Yes.
dealing with it. All right.
Hmm.
So it is cervical. We always have that battle with that term, saying it. But it is that time of the month. The folks at the Trinidad and Tobago Cancer Society are here for us. You just heard Dr. Asante mention not only the process of doing your pap smear, how easy it is making that appointment, and also how easy it is in terms of the support that they offer. So, Doc, before we wrap it up and head out of our show for today, can you talk to those persons who are listening right now, right now? They need to connect with you guys, be it via Facebook or the various platforms, or pick up the phone to make that appointment. How easy is it?
It's very easy. So 800 TTCS is our number for our switchboard. We're on Facebook, Trinidad and Tobago Cancer Society. You can always send a message and we will get it to the clinic. Instagram, TT Cancer. We have Facebook, Instagram. We have a website, www.cancertt.com or cancer.tt, sorry.
Mm-hmm.
You can find us everywhere. So it's not hard. Just type in Trinidad and Tobago Cancer Society and we will pop up.
Where
So,
are you located again?
69 Dundonald Street, which is right next door to Häagen-Dazs off the Savannah, the Queen's Park Savannah. So it's right there. And I want people to understand, we have packages available, a PAP mammo package, PAP mammo clinical breast, so don't be afraid, maybe make it a hangout, you and a girlfriend or two, go and do PAP smears, so just give us a call and let us know. And I look forward to hearing how your service went. I look forward to hearing how things go, because we want you to understand that not because we are cheap and low cost, it means that your service is comparable to that. So it's stellar service training for a low cost so that it's available to everyone across the board and that there's no excuse to not getting your screening done.
I'm glad you said that as we wrap this up, because not too long ago, my neighbor actually texted me and she says, Jay, I know you did your package at Trinidad and Tobago Cancer Society not too long ago. That would have been November, December, somewhere there. She says, I want to go in. So, I shared the details about the contact numbers, the Facebook as well. And, I think she went in along with a friend to get hers done. So, some may be thinking the package is gone because you had an offer in November, December. So some are thinking it's only then, but you do have packages.
We do have packages now. So you just call and ask them and let us, and we're there. I mean, you can't go wrong.
And this is indeed the final question. How are you guys working things around with COVID-19? Because we've got a protocol. So what's the difference?
We're following all health protocols for health institutions. So it's washing your hands, sanitizing, temperature checks, your name and your address, everything is in the system, recording. We have the social distance spacing. We don't allow more than a certain amount a certain amount of persons into the building at one time. Yes. You have to wear your mask. It has to cover your nose and mouth. So everything, the same protocols that you do in every single healthcare facility, it's what we observe at the Trinidad and Tobago Cancer Society.
Great. As always, Doc, thank you very much for your time. The live checkup. You got your checkup right here with us. Join us every Wednesday or Thursday. We still have to decide when we're certainly going to be having this sit down, but we will get it together soon. It's technology. So join us though. And also please share this with everyone because everyone needs the information. All right. And thank you as always, Dr. Asante Le Blanc. I will see you soon. And we will be doing Vertigo pretty soon, Gina.
Well, yes, Gina, I promise Vertigo, but next week we have to speak about the so-called beginning of a year, everybody's resolutions and detox. Yes, no, what do we do? Give a good breakdown on that and our thoughts, weight loss, no weight loss, what do we do? And then we'll go into Vertigo, I promise.
And even doing the detox correctly, because I can attest, doing a detox and still eating rubbish. That make any sense? No.
And do we really? Yeah. So it's a discussion. It's a discussion for sure.
Thank you very much, as always, Doc. And
it's my pleasure. It's my pleasure. Thank you very much.
That's it for the live checkup for today. See you guys soon. God bless. And click like and subscribe. Take care. And that's it. Another episode of The Live Checkup with Dr. Asante Le Blanc. This is where I say to you, thank you for your time. Thank you for listening. Thank you for the questions as well. You help me do my job even easier. And of course, it's always good to have Dr. Asante inside of our world virtually discussing some of the very important topics pertaining to our health. Now, if you've got that topic for a health discussion with Dr. Asante Le Blanc, don't hesitate to connect with us. In fact, send that email to jdsocial jdsocial868@mail.com. Yeah, and we'll certainly put our heads together and bring forward another one of the episodes with you in mind. So don't forget, jdsocial868@mail.com. Check out my website as well if you're looking for any voiceover talent or maybe a host for an event, whatever it may be. Check it out, www.jdmedia868.com.